Shona, I'm sure most of our listeners know what your kidneys are. These are two bean-shaped organs that are situated just above your waist. They are retroperitoneal, meaning they are behind the lining of the abdomen. And we get a lot of patients that come in pointing to their lower anterior abdomen saying, I have a problem with my kidneys. Okay. That's not where your kidneys are situated. That's where your bladder is situated. Right. Your kidneys are at your back. So we have two kidneys. They are about 10 to 15 centimeters in size. And the job of your kidneys is basically to get rid of excess fluid and excess waste, like urea, from your body. Your kidneys also have other important jobs. So your kidney maintains your acid levels of your blood. It also makes important hormones, which makes red blood cells, an active form of vitamin D for bone absorption, bone formation, teeth formation. And your kidneys get rid of excess fluid, so that fluid doesn't build up and give you shortness of breath. And your kidneys also control your salts and your nutrients and minerals like phosphorus, sodium, potassium, calcium. So your kidneys have various jobs. They're not just there for making urine and to get rid of water. They have lots of jobs. Now, the problem with your kidneys is because they have been made so efficiently, it's very difficult to notice that you have something wrong with your kidney until it's almost too late. So that is why we find that most patients present with chronic kidney disease when they are around stage 4 or 5. If you have a very investigative GP or very investigative medical officer looking after you, then they would be able to pick up small changes in your urea and electrolytes, which is a blood test, or even in your urine very early on. And that is when you're able to actually say that somebody has an impaired problem, an impaired kidney or a problem with their kidney. Sure. And it's important to pick this up when they are in a stage 2 or stage 3 phase so that you can put in plans to prevent or to slow down the progression of kidney disease.
So there's obviously a couple of stages to kidney disease?
So there's different stages to kidney disease. And we base your stages of kidney failure on something called a GFR, which is a glomerular filtration rate. And a glomerular filtration rate tells us how efficiently your body gets rid of waste products. And this is calculated from a blood test called a urea electrolyte. It is one of the blood tests that should be done annually in people that are at risk for kidney failure. Now, people that are at risk for kidney failure, especially in our Indian community, is people that have high blood pressure or hypertension and diabetes. In the African population, you also find a lot of people that are at risk for kidney disease because they have hypertension, which is usually difficult to control. Other causes of kidney disease are things like a horseshoe-shaped kidney, people that have polycystic kidney disease, sometimes autoimmune conditions like lupus or SLE, or
What's
even...
SLE?
So SLE is an autoimmune condition. So an autoimmune condition is basically where there is something that triggers off your immune system. And this trigger does not switch off. So it's like an immune system that's in a fighting mode constantly. And it then starts to make antibodies and starts to settle in parts of your body, like your joints, which can give you an arthritis, sometimes in your kidneys, which can damage the nephrons of the kidneys, sometimes in different parts of your lungs, which can give you fluid collecting in your lungs. So autoimmune conditions basically attack different parts of your body.
So this could also attribute to the degeneration of your
kidneys.